Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you so much for joining me and my guest. My guest is Caitlin Kirby. She is a public health nurse in the city of Quincy. Caitlin, welcome back.
Thank you for having me, as always.
It's always a pleasure. Today's topic was one that you thought would be worthy of discussion. Certainly it is. The importance of blood donation.
Yes, this is something that we need all the time. So I think it's just important to highlight, because a lot of people don't even think about it. But it's important to know, like, if you are healthy and you have the ability to donate, it's wonderful to save lives. So I just thought it was important to kind of highlight why it's so important.
Absolutely. So, as we normally do, we will start with an outline. We will talk about the facts of blood supply demand, which you had hinted at. What are the donation types, the basic requirements for donation, and contradictions to donation, preparing for your appointment, after donation tips, and we will end with resources. So let's look at facts about blood supply demand.
Yes, so these were some facts that were highlighted by the American Red Cross. So every 2 seconds, somebody in the United States needs blood and or platelets.
Every 2 seconds?
Every 2 seconds. Blood and platelets cannot be manufactured. They can only come from volunteer donors. So that's why it's so important to advocate for people to donate. Approximately 29,000 units of red blood cells are needed every day in the United States. And then the average red blood cell transfusion is approximately 3 units. I thought that was important to kind of see, like, one person donating only 3 units when we need 29,000 units a day.
Right.
And that, again, this is all statistics just for the United States. A single car accident victim may require as many as 100 units of blood. So again, that one donation might not even help one victim. So you want to make sure, if you are eligible. The blood type most often requested by hospitals is type O. And donation can help more than just one life. There are, of course, many other facts out there, but I just thought these really hit home as to why it's so important and why we rely on the general population to donate to people in need.
Right, and ourselves, the two of us, may end up in a hospital and need blood donation and not think about how the blood got there.
Yes, and that a lot of times you never know when you could potentially be that victim that needs it. A lot of times in surgeries, people may need it unexpectedly. So that's why it's always nice, and like, if you are healthy enough to donate, you feel good because you're giving back to the world. You're giving back, and you could be saving someone else's life. So as you said, you never know when you might be that victim that needs it. So it doesn't hurt to know the information and donate when you can.
And we should also mention that your body continually produces blood.
Yeah.
So when you donate, I don't know how long it takes, so maybe we can talk about this,
Yes.
for that production to, I suppose, level off in
Yes.
one's body after a donation. But the point is, you will make up those cells that you donated.
There are 4 main donation types, and with each one of those, we'll see how long in between those donations. So it kind of goes into how long it takes your body to reproduce those. And when we go into the facts before donation and then after your appointment, it goes into how to replenish your body after you donate.
The donation types, so let's talk about those types that can be donated.
Yeah, so we have 4 types. The most flexible donation type is a whole blood donation. So who does this help? Whole blood is frequently given to trauma patients and people undergoing surgery. I know, like, a lot of mothers during labor also may need this.
Good point.
Ideal blood types. So all blood types are welcome and all blood types are needed. In donation frequency, so for whole blood donations, every 56 days, you are eligible again to donate. And this is up to 6 times a year, that would be. So people who are kind of on a schedule, they'll know this. But when in doubt, give a call to a facility to see when you can go. The second kind we have is the Power Red donation. And this is what the American Red Cross considers it. So the Power Red donation, it's an automated process that separates your red blood cells from other blood components. And then it safely and comfortably returns the plasma and platelets back into your body. So you kind of don't realize that it's going back into you, but they're really only taking those red blood cells from you.
Oh, that's an interesting process.
Yes, and who needs those? So the red blood cells are typically given to trauma patients, newborns, and emergency transfusions during birth, people with sickle cell anemia, and anyone suffering blood loss. Ideal blood types we want for this is O positive, O negative, A negative, and B negative. And then donation frequency every 112 days. So this would only be up to 3 times a year.
As opposed to the whole blood donation, which is up to 6 times a year.
Yes. So there's some differences there. And it's also important to know for the red blood cell donations, the universal donor would be type O negative. So anybody who's donating that has type O negative, their blood can go to any other person.
A lot of people might not even know their blood type.
Yes, and so with your blood type, you can follow up with your doctor. It potentially could be in your medical records if you needed it in the past, if you needed a transfusion. But I do know that when you do go to donate, a lot of times they'll give you a phone number. So like 24 hours after it's collected, you can call the lab to see what your blood type is. And I do think it's important to know your blood type because God forbid you're in a situation where you need a transfusion. But the hospital, of course, has your best interest in mind and might give you the universal donor blood if it's on hand. But also, you want to know because if you do have O negative, then and you are healthy enough, it is important for you to get out there to donate. So that's why I always like to tell people to know, and even myself as a public health nurse, I've had transfusions in the past. Years ago in surgeries, but I still didn't know my blood type. So after one of my recent donations, I had to call them to double check it. So
yeah, well, you and I were talking about that at the beginning of the show, actually before we actually started recording, that I wasn't aware that you're not told that day what your blood type is, but with a simple phone call, you can find out.
Yes.
Which is provided to you. Let's talk about platelet donation.
Yeah, so next we have the platelet donation. So platelets are teeny cells in the blood that are used to form clotting, so it stops bleeding. So platelets are a vital element for cancer treatments and organ transplant procedures, as well as other surgical procedures. Ideal blood types that we look for donation are A positive, A negative, B positive, O positive, AB positive, and AB negative. And then donation frequency, this can be every 7 days. So this can be up to 24 times a year. And then lastly, we have our plasma donation. So the plasma is a part of your blood that is used to treat emergency situations, which I will say each one of these can go for emergency patients. Sure. I think I've said it with each one.
Right.
So who this helps, the AB plasma is used in emergency and trauma situations to help stop bleeding. The ideal blood types we look for are AB positive or AB negative. The universal donor for plasma would be type AB blood. And then donation frequency every 28 days, so that can be up to 13 times per year.
So I guess as I'm going through this and as you're talking about this, I'm wondering if someone does want to donate, there's a lot to keep track of, right?
Yeah.
So as far as what you are donating, is that the choice? I suppose ultimately it is the choice of the donor, but how do you know whether you're going to donate plasma?
I would check in with that facility where you are donating. If you look up even a quick Google search to see locations around you, I know the American Red Cross has many locations, Mass General, Boston Children's. So there's a lot of different donation places to go to. So I would check in with that donation facility, and they will they'll be the people to know
So would
what's
they
needed.
ask you, right, what
Yeah.
they need and what you're willing to donate?
Yeah, so they would kind of do an assessment there. And a lot of times, like I know we have, we collaborate with Dana-Farber, and their craft blood donation bus actually comes right to us here in the city of Quincy. And I know they're mostly collecting that, the whole blood donations. But I would say check in with the donation site, and when they're giving you your health history and they're looking at all of the credentials, basically, they will kind of let you know what's the best thing to donate and what they're looking for.
So they will guide you.
Yeah, so I always say, when in doubt, ask for guidance, and those facilities where you're donating are the best people to ask.
Very good. Let's look at the basic requirements to donate.
Yeah, so basic requirements, and this is for Massachusetts specifically, so it's kind of universal, but I would say check in with your local public health or state health department.
Which is well said because, as you know, this program does air across the country. So certainly check in again with your local state.
Yes, yes. But basic requirements that we see, so donors must be in good health and feeling well that day. So if somebody's coming in with a fever or a runny nose, they shouldn't be there. You want to be in good health. Donors must be at least 17 years of age, or some facilities, if they're 16, they may be able to do parent consent to donate. I thought this was very interesting. There's actually no upper age limit on when you have to stop donating, as long as there's no other restrictions or limitations. When we go into the contraindications, there are things that could defer you off the list to donate. So even somebody, I just thought that was important, because a lot of people might think like, well, I'm 80, I can't go donate blood. But
Is my blood any good?
Yeah,
Right.
so that's
Okay.
not a thing. It all goes into, there's no age discrimination. It just goes into your lifestyle and your health history.
Sure.
Also, two other things that we see, so our weight, it has to be at least 110 pounds and no more than no more than 350 pounds. And then you also want to make sure you're bringing your photo ID with you when you go to donate. So when a donor goes, they'll be given a questionnaire. So this goes through your health and lifestyle questions to determine your eligibility. So temporary deferrals. So for example, I couldn't quite fit everything in here, but I just wanted to give examples. Temporary deferrals, like say somebody's on an antibiotic, you may have to go 24 hours without that antibiotic before you donate. If you're currently ill, they'll defer you until that illness is gone. Travel, especially if you traveled to a place, for example, malaria, if there's a lot of malaria in that area, if you travel there within a certain time period, they may refer you and tell you to check back in a couple months. And then even something that you wouldn't think of, but even getting an ear piercing or a new tattoo. If it is in a licensed facility, which I think it's important for people to know that local boards of health, we license all of our tattoo shops. If it's in a licensed facility, because we make sure that they're doing a sterile job, obviously, that might not defer you. But if you did, like say you went out of country and you got a new tattoo and they can't really validate, they probably will defer you for a couple months before you donate. And then there are also permanent deferrals. So there are certain health conditions, like there are certain types of cancers, and for example, like HIV and AIDS, which HIV can cause AIDS. A person with that history might be permanently deferred.
Right.
But I thought it was important to note that there's temporary deferral. So just because you're deferred once doesn't mean you can't go back. So when in doubt, call to check in. And there are things that have been changing with this. Like I know they used to be if you had a history of drug use, you couldn't donate because of the shared needles, that concern. But now things are changing. The eligibility is changing because of the screening process of the donated blood. So when in doubt, call that facility to double check. I didn't want to go into each and every one because this questionnaire can be quite lengthy.
Sure.
And it goes into a lot of medications. For example, aspirin, if you're on aspirin every day, you might have to defer that for like 1 or 2 days before you donate blood. So check in with the donating facility before you go to make sure you're following their plans appropriately.
What does aspirin do to the blood?
It can be a blood thinner.
It's a thinner.
Yeah.
I thought so.
Yes,
Okay.
to help prevent clotting.
Let's talk about preparing for your appointment.
Yeah, so preparing for the appointment. So this is all the wellness tips and tricks we probably say every episode. But you
These
want
all look familiar.
Yes. So getting adequate sleep. So you want to arrive well rested. You want to aim for around 8 hours of sleep the night before. Staying hydrated. So that's one of my favorite things to say as a nurse. So you want to make sure you're drinking water prior to donation to help reduce the risk of low blood pressure, which can cause adverse effects such as fainting. And it makes it easier to access your veins as well. So if you're drinking 8 ounces of water before you go, you'll have more fluid in your veins. So hopefully that stick, the needle stick might hurt a little less. It'll be easier
That's
to
a good,
access.
right. It'll be easier to be seen.
Yes, yes. And then you want to make sure, so on the flip side of this hydration, you want to make sure that you're avoiding alcohol and caffeine consumption because those both lead to dehydration. So it goes the same way.
Now, people might say, well, there's water in my coffee, but it's also a dehydration agent.
Yes, that caffeine in the coffee still dehydrates you. I know sometimes I'll get that large coffee and I'll sip on it all day and I never feel so dehydrated at the end of the day. You also want to make sure you're eating healthy, so make sure you have an iron-rich food such as red meat, fish, poultry, beans, spinach, iron-fortified cereals, and raisins. They will actually, when you go there, they will check, like they kind of stick you to check your hemoglobin to make sure your levels are high enough to donate. Because if your level's too low and then they take your blood, you could faint.
Right.
So they are monitoring your vitals before you donate, and they're monitoring again that hemoglobin level to see where you start at.
And is every donation, is there I suppose a custom amount that is taken from a person, depending on what you're donating, I guess?
So that could depend. That could depend. I didn't go totally into that. When I was looking this up, how I broke it down between like who it helps and how often you can donate, they also put in there how long the donation might take. So for example, like the whole blood cells, you might be there for 10 to 15 minutes. Whereas if it was plasma, it could be 2 hours. So it all comes, you have to know what you're going in for.
Right.
Yeah.
Understood.
Yeah.
Bring your ID, which you had mentioned
Yes.
prior. Dress comfortably.
So-
and this is interesting.
Yeah, so dressing comfortably, because they're going to need access to your arm, obviously, to insert the IV, and to check your blood pressure. So you want to make sure you have like this shirt is pretty thin. You could take my blood pressure over this, but if I had a really thick, heavy sweater on, you couldn't take it over. And so that goes into even when sometimes we give vaccines out, and people will come to us in the middle of winter and have a big heavy sweater on, but then they only have a bra on underneath, so they feel uncomfortable taking their arm out. Which you don't think about that on an everyday basis, because who's taking their arm out when they're out in public? No one.
Right.
But you want to make sure you are dressing comfortably to make sure you have that full access and you feel they will give you privacy, of course, but just depend. You want to make sure you feel comfortable.
After donation, some tips.
So once you donate, they will actually have you sit there for a couple minutes and they'll offer you snacks and drinks. So a lot of times they'll give you apple juice to kind of give you that spike of sugar to like give you a little more energy back. But you want to make sure that you're taking the time to relax, because if I donate and then I just jump right up and I run to my car, there's a likelihood that I could pass out. So this gives the nurses and the staff the chance to actually monitor you right after as well. With that hydration, you want to make sure you're still drinking the extra fluid. So drink an extra 4 8-ounce glasses of liquid, and again, avoid that alcohol. Keep the bandage on for a few hours, especially if you are somebody who has been on blood thinners. Of course, you'll be getting recommendations before you donate to like stop that blood thinner and so forth. But if you are at risk for bleeding, make sure you're keeping that bandage to keep the pressure on the site. If the site were to start bleeding, you want to make sure you apply pressure and raise the arm up for 5 to 10 minutes until it stops bleeding. If it's heavy bleeding, when in doubt, call 911 if it seems like an emergency. You could try to call the facility back, but if they're not there and you're no longer there, they'll probably tell you to call 911. Continue your iron-rich food. It's important to know, too, that vitamin C is very important for your body to absorb iron. So that's something to take into account, too. And then also take it easy by avoiding strenuous activity. You don't want to go right to the gym after either. You want to kind of lay low, and because you are taking away from your body, so you want to make sure you're getting that hydration, you're getting that nutrients back, and you're getting adequate sleep for your body to revive itself.
Very good. I've been given my 2-minute or 3-minute warning from our floor director, James. So the last bit that we haven't talked about are resources.
Yes. So this information today I got from the U.S. Department of Health and Human Services. So that is the HHS.gov. Also the American Red Cross, which is redcrossblood.org. There is also a wealth of information from all of our local hospitals, so Mass General, Boston Children's, Boston Medical Center. So definitely there are tons of options out there. A lot of these facilities have vans and collaborate with local cities to really make it easy, because I know our collaboration, they come out 4 or 5 times a year, just to make it easier, because a lot of times people will just see a sign on the side of the road that says blood donations this way, and if that person has free time, they'll go check it out.
Right, and it can take anywhere from, depending on what's being donated, anywhere from 10 minutes to potentially 2 hours. But
yes,
again, that can be determined when you schedule an appointment or stop by to see if they could potentially help you or use you at that moment.
Yes, and I'm a very big advocate for mental health, and something you can do for yourself, for your mental health to feel good, is to give back to your community, give back to others. So you might not know somebody specifically who needs these blood donations, but again, you never know when it might be yourself or your loved one.
And just knowing that you're helping somebody else.
Yes, it's really good for us as a society. You have to be a villager to have a village, you know?
Absolutely. That's a good ending. We will end it there. Thank you so much,
Yes,
Caitlin.
thank you for having me.
A pleasure. And thank you at home for watching, and please remember to support the local access station in the community in which you reside.
you.